Hey folks, this is going to be something a little different. I am finally trying this through Zoom. It may mess up completely, but I'm giving it my best shot. So it's Friday, August the 27th, the last Friday in August. September is here. And got a right good bit to talk about today, but I'm going to move as quickly as I can through it. But first, I always begin with all things COVID. And for that, I want to share with you some information. I'm sharing, at least I'm going to try to share my screen with you because this is now on Zoom, not on a normal video. And on Zoom, I can share my screen. So anyway, these are slides, literally, from Dr. Jane Kelly, the state assistant epidemiologist. And there's a lot of things that are in here. I just copied a few of them. This is where we were at the end of last week. These were slides that Dr. Kelly presented on Tuesday at a series of meetings that happens every Tuesday called Grand Rounds. This is the surge that we are in right now. And if that doesn't scare you, talk with me sometime because it scares the daylights out of me. As you've seen, she says on here, we have not seen this many daily new infections since January. And consistently, the age groups 15 to 24 and 25 to 34 are the highest in new cases. It's not us old people that are getting sick. It's the younger ones. And why? Because they haven't been vaccinated. The other thing that concerns me the most on this is how steep this curve is. You know, in the past, the curves kind of went curvy up, but this time, Delta, it's going almost, it feels like it's almost going straight up. So this is kind of alarming. One of the things that everybody has on their mind is things around what's happening regarding the third shot, the third vaccination, and then the boosters are, of course, on everyone's mind. There is a difference between this third shot that is happening right now to those who are immunocompromised. And there's a big list of who falls into this category of being immunocompromised. I'm not going to get into nitty gritty of that because it is on our webpage and that's very much available. But then there's this issue of booster shots and the difference in what the two of those might be. And there is a bit of a difference. The booster shots are going to be offered, and this is straight out of what the CDC is saying, that we're going to be prepared to offer booster shots for all Americans beginning the week of September 20th. And starting 8 months after the individual's second dose. There's still some final things to be determined, and we'll hopefully be getting a final notice from CDC. There are all sorts of reviews that have to happen, FDA and this committee that meets out of CDC in a combination with FDA, but we think it'll happen pretty quick because they have already publicly announced that these booster shots will be available. Will CARE South Carolina be giving them? Yes, absolutely. And since it looks like the criteria will be that if your second shot, if it's been 8 months since your second shot, you would be eligible for doing that because remember who got that, who were first in line, so to speak, to get the first shots. It was healthcare workers like us, long-term care facility residents, seniors. So there's no need to begin with those same criteria since 8 months ago, those were the high priority ones. So we're going to be staying in touch with that. Some of the other questions that come up about why doesn't a positive antibody test, why isn't that enough to avoid quarantine? Why doesn't the same benefits of less quarantine with a test as it applies to a vaccinated person apply to a person with a positive antibody test? Well, there's a lot of reasons for that, and I've stolen this slide from Dr. Kelly, that reinfection is rare if it's within 90 days. Notice 90 days. The antibody test doesn't indicate, though, when that prior infection did happen. In other words, for folks that, were infected, let's say back in November, September, even June or July of last year, those antibodies might really, really be gone. And you might be thinking, well, why are the antibodies from having had the disease and the antibodies from the vaccine different? Well, here's that bullet that Dr. Kelly put on here. The vaccines are engineered to give a very high neutralizing antibody level. Now, I know that gets down into the weeds for some of us folks that aren't clinical. They provide certain things like robust B and T cell responses. And that's different. That's different from the antibodies that you got if you did get the disease. So, and remember that prior infection from what is now being called the wild type of COVID is a bit different from this variant that is now viciously moving throughout what seems like the world, but especially South Carolina, called Delta. This is about the third dose COVID vaccine, and the reason why the one that is coming out the week of September 20th is called a booster. And right now, this is being called an additional dose, not a booster, but it's an additional dose. So that's just kind of an explanation on that. Remember, Delta spreads much, much more easily. You see these little kind of purple or purplish things here that are in these droplets, and you see that there are 8 of them. That is because we're learning that Delta can spread to as many as 8 more people. And if you think, well, why is that important? That's important because in the beginning, that initial COVID, the virus that was out that we're now calling the wild type, the average spread was only 2.4. But unfortunately now with COVID, the average spread is proven to be as many as 6 or 8. That's why this has gotten to be such a significant problem, because the darn thing spreads to so many people so quickly. Is this a problem with CareSouth? Yes, it is. Only 65% of our staff are currently vaccinated. Now, I know you may be thinking, but Ann, you said we had almost 80% herd immunity, but remember, herd immunity also included those who had some antibodies. But now, 8 months after most of us were vaccinated, and several months after, over a year after the virus first started, those antibodies from having had the disease are seriously diminishing, if they are even there. That's why those of us who were vaccinated, we're getting our booster vaccines the week of September the 20th. But we have had 7 additional staff that have gotten their first dose of the vaccine and will very soon be getting their second dose. So more and more of our staff are stepping up. Because right now we have 22 staff on quarantine. And I know that drives y'all crazy, because you've got work that has to keep on going. And you've got partners, you're in your team, and people that you rely on to help with the work that are in quarantine. And that quarantine is for a lot of reasons. Our schools, we have 14 of those that are on quarantine because their kids have to be on quarantine from being exposed in schools. Here we go. Delta is spreading rapidly, and we do not have near enough people out there vaccinated as we should. Just this week, we've had 2 more cases of employees tested positive, 9 since the 1st of August. Yeah, It's really beginning to creep back up on us. Folks are testing quite a bit more. We are testing anywhere from 200 to 300 people a day. Just a month ago, we weren't testing that many in a whole month. This is really creating some backlogs and some real issues in our flow, our workflow, not just for the lab, but also it's impacting everything. We recently have reissued some testing guidelines. Not everybody needs to be tested all of the time. So I'm not going to get into the weeds with that, but look for that. It's testing guidelines that have been reissued when people and which people need to be testing, because it's not everybody all the time. So please take a look at that. I'm going to switch out of all things COVID now and try to give you some updates that are relevant to just CareSouth in general, but I can't say enough about how this is impacting our care. Our roads units have even had to cancel days that they've been scheduled to give kids sports physicals because the team is on quarantine. So I cannot say enough about how important it is for vaccination and, of course, for masking. I'm going to move along now, though. We have had excellent news this week about St. David's. The USDA is providing us with a loan to be able to do those renovations at St. David's, which are very extensive, by the way, so that we can move a lot of administrative services in there and get back to centralizing things and, frankly, have more space. The loan was approved and things are going to begin to happen quite rapidly now at St. David's. We're really looking forward to that. What about all the other places that we're doing either building or renovations? Well, our Dillon new building, moving along really good. Weather has been actually great for that new building. They are anticipation, if the weather holds out and supplies can get delivered, they're anticipating about mid-February. So that's really good news. In Sherrall, even, we'll be getting a survey done and get that land purchased right away. But remember that we can't actually begin on the building or anything like that until that grant, which is paying for a substantial part of that, will need to be approved, though that will happen in September. And Sherrall will be happy to begin on the Sherrall building soon after that. Folks over there in Chesterfield, I know you're frustrated because your pharmacy isn't open. Man, are there 101 hoops to have to jump through. Ashley Singleton, our chief of pharmacy, is jumping through those hoops as fast as she can, getting approval. So sit tight. There's a lot to be done, but we're hoping to have that pharmacy open because that has a drive-through also. And I know the patients are chomping at the bit to get that pharmacy available. There's another thing that's going to be happening in the month of September. You may or may not recall that I told you a while back now about a hypertension grant that we received. And this hypertension grant was very specific to providing home monitoring devices for folks with difficulty controlling hypertension. So it's taken a little while for it to kick off, but it is kicking off. Tanisha Cannon, an RN, has been hired, and she's been in place now for a little while. She is in our Department of Value-Based Care, and she's sort of overseeing all of this. But there will be Sentinel devices going out soon. These devices will be targeted to our patients on Medicare with hypertension needs and hypertension issues. And then also another type of a device, a time dot device, will be going out after assessments have been done on other patients that will be candidates for these new devices. We have 2 RNs also that have been hired for that. Nurse Cannon will be overseeing that also, but this is going to be a really cool thing to have so many of our patients have these home monitoring devices that'll be able to assist us and tell them where they are in monitoring their blood pressure and hopefully getting their blood pressure under control. So things still going on. It's not all things COVID. Let me remind you also of the town hall that's going to be happening September 23rd, Thursday. It kicks off at 9 a.m. with Dr. Jane Kelly, who's going to be giving us a good perspective on what's happening and why the vaccination is so important, where we are in the cases, how Delta is being handled. And by then, we will probably have some news about the boosters. So Dr. Kelly will be with us at 9 a.m. and then there'll be questions and answers period that'll be open to anyone. Now, I know that people are going to be a little bit bashful about raising your hand and wanting to ask a question when there's 500 other people listening, because this is a town hall for which all Care South Carolina staff will be participating. We're working out logistics of how to make sure that's happening. So in order for you to feel comfortable in asking your question, we're going to do it a number of ways. You can just send me your question, but you know that I'll still know who you are. You can also send it to your supervisor, who can send it to me anonymously. Ooh, say that word 5 times. But because that still is kind of iffy, we're going to put these boxes available in every site. They're going to be out there and you can just drop in your question. You don't have to sign your name or anything. And we'll make sure that that question gets asked to Dr. Kelly and she can reply. So please make this a dynamic opportunity. Get your questions in. I know you got lots of them. Get your questions in because she is more than willing to answer them in this special session. Now, after that, we're going to have some training that we're going to be making available. We figured out that this discussion around that folks may have around this vaccine, this COVID, these whole masking questions and everything are really conversations that are best held one-on-one. And sometimes those are kind of difficult conversations. But we're going to be offering some training for this, specifically right after this town hall. This training will be offered for providers, nurses, and other frontline staff. And then this training is going to be repeated the next day. It's going to be offered to folks like community health workers, outreach, patient advocates, and other folks that will be interested in getting the training and out there in the community. So we think that this is going to be a good opportunity to learn how to have these sometimes rather difficult conversations. We're hoping that this will be of value and that this will be of value to you. Many of us are having conversations with our family members, with folks in our church. So I'm looking really forward to this training, and I hope that folks will take advantage of this. Okay, folks, I hope that this model of my video worked. I'll soon find out. But in the meantime, stay safe, be careful out there, have a good weekend. But remember, there's a very vicious virus out there with a very vicious variant called Delta. We care about all of you. And we want you to stay safe, and your family and your friends and your community. Stay healthy.